What's up, class? It's Lex here. I'm going to be talking about emergency preparedness, CPR. Uh, cardiopulmonary resuscitation, CPR, is a life-saving technique useful in many emergencies, including a heart attack or near drowning, in which someone's breathing or heartbeat has stopped. The American Heart Association recommended that everyone, untrained bystanders or medical personnel like us, begin CPR with chest compressions. I know a lot of you are like, man, we already know CPR. What is he talking about? Well, I'm just refreshing us, I guess, on CPR. In the event that we're in a mall or a library or somewhere where we aren't backed up by a crew or have our medications or anything like that. This is more like a first aid without none of your medical supplies or your stretcher or your all our gadgets that we have on the rescue truck. What we do. What exactly could we do to help a patient? So just remember, if somebody drops down in the mall, this is what we're doing. It's far better to do something than to do nothing at all. If you're fearful that your knowledge or abilities aren't 100%, remember that the difference between you doing something and not doing anything could be someone's life. Trained personnel like ourselves who's ready to go, uh, begin with chest compressions instead of first checking the airway and doing rescue breathings. Start CPR with 30 chest compressions before checking the airway and giving rescue breaths. If you're trained but a little rusty, um, start by first checking to see if the patient's alert, oriented, conscious or not conscious, and then begin chest compressions at a rate of 100 until 911 gets there or until someone who is a little bit more trained than you are to take it over. Remember, CPR keeps oxygenated blood flowing to the brain and vital organs like the heart until more definitive medical treatment can restore normal heart rhythm. When the heart stops, the lack of oxygenated blood can cause brain damage in only a few minutes. A person may die within 8 to 10 minutes. Uh, Before CPR, check to see if the person is conscious or unconscious, as we all know. If a person appears unconscious, tap or shake him, give him a little sternum rub, and ask him if he's okay. If there's no response, have someone call 911 and you begin CPR. Also have a third guy go ahead and see if they find the AED, which at local malls and libraries and schools, and uh, and all these other places, AEDs are everywhere now. It's every 100 feet, if I'm not mistaken. Have someone else get the AED and bring it along. Um, Remember CAB. When I went to paramedic school, we were taught ABCs, airway, breathing, circulation. But American Heart Association wants us to get rid of the ABCs and learn CAB, circulation, airway, breathing. Circulation is the most important thing, according to American Heart Associations at this time. Circulation, restore blood circulation with chest compressions. Place one heel of the hand above the center of the person's chest between the nipples. Place the other hand on top of the first hand. Keep your elbows straight and locked. Position your shoulder directly over your hands. Use your upper body to push straight down on the patient's chest at least 2 inches deep. Push hard at a rate of 100 compressions in a minute. If you if you haven't been trained, continue compressions until EMS, fire rescue, or another more qualified trained person gets on scene. Uh, Airway, clear the airway. Check for normal breathing. Look for 5 to 10 seconds for chest motion. Uh, for normal breaths, look and feel for a person's breathing on your cheek, or feel for a person's breathing on your cheek or on your ear. Gassing is not considered breathing, so remember that if he's gassing, that's not breathing. If the person isn't breathing, begin begin breathing for the patient. What you want to do is a help tension lift maneuver. Pinch the patient's nostrils and cover your mouth with his mouth, so that way you can create a good seal um, and give 2 rescue breaths. Continue CPR. Continue CPR right after. Again, 100 compressions in a minute. To perform CPR on a child, it's the same process. The only difference is you're doing it with one hand instead of 2 hands on the adult. and be more gentle when you're breathing for children. Children have smaller lungs. You don't want to cause a pneumothorax, pop their lungs. So be more gentle when breathing for a kid versus an adult. To perform CPR on the baby, again, it's the same process except for um, you want to go a half an inch deep with two fingers to the center of their chest, and you press at 100 compressions in a minute. And once again, this is only if you're somewhere where we don't have our gear and our airway bag, our medical box, or whatever else we carry. You know, if you're in the mall, don't have anything on you. This is what we're doing. So just a little emergency preparedness. Make sure that you're still on top of your skills, even when you're at the mall, the library, schools, or wherever we're at, at the park or something, somebody drops down instantly on you. This is what we're going to do, all right? Hope you guys reviewed something, refreshed something, re-clicked something in your head. So good luck. See you.